Welcome to Motherhood, Aligned and Assigned, where we help guide mothers from symptoms to solutions.
We're Dr. Serena Kaufman and Dr. Veronica Schultz, nervous system specialists helping families discover the missing link in their wellness journey.
Join us as we translate complex health challenges into simple, actionable solutions for you and your children.
Because your family deserves to thrive,
not just survive.
So we recently had someone call into our office who had a lot of questions about autoimmune. And I think the cool thing is no matter what you call into our office about, likely there's a nervous system dysfunction behind it. And we kind of go from there. We start the nervous system and everything usually improves. Or you get to the other side and you're like, okay, now that the storm is calm, I know exactly where I need to go next. So this I'm like, she's not really a patient, but this potential patient called in for her daughter, and she had autoimmune conditions. She was having some dizziness, having some kind of crazy symptoms is how she described it, some issues with her hormones, brain fog, all that kind of stuff. And they basically, the doctors and specialists she'd been going to essentially concluded that she had some sort of autoimmune condition that they weren't quite sure what was wrong. She'd been to Endocrinology, and most of their tests were coming back pretty much normal. She had something pop up for her thyroid, which is kind of funny because I know, Dr. Serena, you're going to have a story about that too. And then she also was going to Neurology, but they didn't really find anything out of the norm for her there. So she was kind of like, what do I do now? We know that there's like gut involved. There's just so many things. And she was saying specifically on the call, she's like, it would just be so nice it's like we go to one place and all they talk to me about is that thing, right? Like I go to endocrinology and all they talk about is hormones, or I go to neurology and all they talk about is their brain. And it's like, where are the people who are going to piece all the pieces together? And I was like, well, you called the right place because that's literally what we do. And, this is an interesting episode because it's not a case that I'm currently seeing, but I think we'd like to talk about the science behind how we can help. And I think there's even a cool story that Dr. Serena is going to share about how you can even track progress and see how that nervous system, autonomic system, and sympathetic and parasympathetic systems influence the hormones, and how you can actually track that progress and see how the body is producing or not producing the hormones it needs, which could be influencing those autoimmune conditions that you or your child or teen are experiencing.
Yeah, and let's just chat about this potential patient's likely journey through the standard medical system. Is she's probably going to be told to manage it, like manage the symptoms, manage the flare-ups. And at the endocrinologist, she's going to get a certain supplements or medications to manage the hormone issues. At the neurologist, she's going to get a separate prescription. The next place she's going to leave all of these different offices where they're trying to collaborate, but it's not going to be pretty because it's just so hard to manage. It's so hard for our current medical system to co-manage complex autoimmune issues because no one actually knows what's going on. If you're going to different branches of medicine, they're not sitting down in the same room and talking about your case, most likely, right? So it's going to feel really scattered, and you're just going to get medications from all of these places. And going to a functional medicine provider can be better because they're going to have a more holistic, let's look at the whole body approach. But even then, for example, so one of my patients came to me, and it's actually a good friend of mine, and she was pretty sure she had symptoms of hypothyroidism. And a couple of years prior, and this ran in her family too. So she's like, I'm thinking I'm feeling the symptoms of this, and it runs in my family. But functional medicine providers said that my labs were totally fine a couple of years ago. He said, but I looked back at them and I looked into them myself to look at the numbers, and they're not fine.
Mm-hmm.
And so even, yeah.
The frustration.
The frustration. And so we ran the numbers again just because it had been a couple of years. So I drew labs again, and sure enough, thyroid was struggling. I also did neurological insight scans for her because we were going to start a care plan. That's why she came to me. And there was a lot of stress in the area of her body that would have a lot of control over her thyroid or help regulate her thyroid. And then just nervous system stuff in general going on that was correlated with thyroid symptoms or of hypothyroidism, Hashimoto's, if it's autoimmune, that kind of thing. And so what I don't want to do for this patient is just manage her thyroid symptoms. I don't want to slap supplements on her symptoms and it's like, okay, here's this for sleep. Here's this for your metabolism because you feel like you're gaining weight. Here's this for this, and this, and this for your fertility because that's being impacted, right? I don't want to do that. I want to address the root of the issue, which is there's stress showing up in your nervous system. Let's get rid of that first and then see where you land and build from there. And so her care plan was hit the ground running 3 times a week for, I think 6 weeks, and then twice a week for the remainder of the 3 months. And I did have her start taking a desiccated thyroid supplement, just one thing to kind of support her thyroid while we were doing this, because she wants to have a baby. All right. So we were doing that as a little bit of an extra support. And she took out gluten just to try it. And she felt incredible doing that. Mm-hmm. And at the end of the 3 months, we retook her blood work, we rescanned, and her thyroid was in normal range. Mm. She was sleeping better. She had more energy during the day. She didn't need naps anymore. She felt amazing. And her cycles were starting to change. They were changing. And they weren't perfect, but they were changing. Like, this is incredible. Like, that wasn't the desiccated thyroid alone. Right? That's just supportive. Mm-hmm. And it wasn't just taking out gluten alone. You're not going to see tremendous results in her TSH, her thyroid stimulating hormone, coming down as much as it did in a 3-month range. Usually we're retesting labs every 6 months for thyroid stuff because we don't expect that much change in such a short time. Mm. So it's this huge combination of supporting the foundation of her nervous system first and foundationally, right? Mm-hmm. And then there are these other things that she could be doing that were big extra tasks on her nervous system. Okay, let's remove a stressor, like a chemical stressor like gluten, American wheat specifically, right? And then let's give your body a little support as it's healing, and just massive results, which is really exciting.
Yeah. Way to go, Dr. Serena. That's really exciting.
Yeah. Way to go on her
right.
body.
It's a team effort.
Yeah. Because she also, the thing is, like, she led the charge on, she's like, I'm going to take out gluten and I'm going to see how I feel, right? That wasn't something that I put on her because I don't need people to do big extra life changes, but she really felt that was her instinct, is I need to get rid of this, even though I really don't want to because I love my sourdough. And she was really happy to start on a really natural, God-given thyroid support instead of going the synthetic route. And now she doesn't need anything synthetic, which is amazing.
Yeah, and it just goes to show, I mean, I think the cool thing about chiropractic care always, especially neurologically focused chiropractic care, is that, like, yes, the thyroid improved, but also think about, like, the absorption of the supplement she was taking and the ability to detox all of the other things that her body didn't need, right? It's like, the cool thing is I should say, like, the big picture is, like, when you go to those other places and they're prescribing all this medication for these different things, you're going to see improvement in that one area because hopefully the medication is just addressing that one area. We know it's addressing more than one thing, right? And that's why we have these cascade events of, like, you're taking one medication, now you need another medication for this thing. And the same kind of effect happens with chiropractic, but on the positive route, where it's like, yes, you come in for your thyroid, but we're also improving digestion. We're also improving sleep. We're also improving reactivity and your ability to handle stress. And it's like all of it is headed toward the right direction for function across the board. It's not like you're just coming here taking one thing and it's going to affect that one thing. You're coming here to get adjusted to improve the function of all of your body. And then you happen to get the benefit on the other side of the thing that you were wanting to see, which is that thyroid improve, which I'm sure is also going to improve her fertility and just everything overall.
And another big factor I wanted to talk about was the vagus nerve. And so on this patient's scans, she also had stress on her vagus nerve at C1. And so that was a big deal to me as well, because our vagus nerve is our brake pedal. So if our brake pedal has low tone and there's interference with it, then our digestion is going to struggle. And that's like all the way into the stomach, that is in the small intestine where we're absorbing nutrients, That is motility in the large intestine, where we're trying to detox, like top to bottom, right? Well, even in babies, we're trying to nurse, right? And that's sleep, hormone regulation again, and then the vagus nerve plays a huge role in setting the tone for our immune system, right? So if the vagus nerve, which is a big regulator for our nervous system, can't tell our immune system that it doesn't have to be in fight or flight, then it might be in fight or flight. Our immune system the same way, right?
Yeah, so just like Dr. Serena hit on the vagus nerve and all the stress that's building up and kind of getting stuck in that gas pedal and not allowing that brake pedal to actually do what it's supposed to be doing, people often ask, like, where did this start? Right? Like, it just feels like this autoimmune condition came out of nowhere. And that is literally never true. Nothing your body ever goes through happens out of nowhere. There's always this like process that's building underneath of the surface that you may not be aware of, but that has been kind of accruing over time. So we call this the perfect storm. And if you have been listening to any of our episodes before this, you know what that is. But if not, welcome, because we talk about the perfect storm a lot in terms of where all of this starts to accumulate. So oftentimes, I feel like we talk a lot about how the perfect storm starts with prenatal stress, but it oftentimes starts with, especially this day and age, fertility and conception, because there's just so much that is going on in the world of conception. I even know of people who aren't necessarily struggling with fertility, but are hearing about it more and being like, is this going to be my journey, right? There's just so much stress of like, how possible is it for me to get pregnant, instead of just knowing that we have this innate ability to get pregnant, because there's so many other factors who are influencing fertility and all the things, right? And so this perfect storm starts at conception into prenatal stress, right? Unfortunately, we don't just like get pregnant and hide in a bubble. We still are going through life. Sometimes you have more kids. Sometimes I feel like there's so many times that like you get pregnant and then all of a sudden your husband has to like leave the country for something, or the state or whatever. Like, why does it happen so often? But then you know, you've got this
pregnant and Chad had to turn down a job here in Idaho. Because, it
happens so much. I have so many patients who are like, I got pregnant, and all of a sudden my husband had to leave. And it's like, why does this keep happening? Yeah. And that's not even, job changes, moves, unfortunately, like deaths in the family. There's so many things that can happen while you're pregnant that help the baby understand what life is going to be like on the outside of the womb, right? And then you've got the actual birth itself, the trauma, the interventions, all of that good stuff. Even if you don't have a lot of interventions, birth is stressful, right? And then you've got the toxins and chemicals of just being a human. There are 3 main ways that the body is found in dysfunction or dysregulation, and they are trauma, physical trauma, toxins like chemicals, and thoughts, right? So your mental health, the things in your environment, as well as physical health, all contribute. And this is what the perfect storm is. It's a combination of those things. It's prenatal stress, birth trauma, toxins and chemicals. Oftentimes after that whole process, now all of a sudden we have a baby that's sick all the time, and now they're getting antibiotics, another chemical stressor, and now the gut is not functioning. Now we have physical and chemical stressors, right? And then we've got early illness and all of the things. And so we, experience that. A lot of times people with autoimmune wasn't just like, I felt great my entire life and all of a sudden I feel bad, right? There's just like, I had digestive issues that I didn't realize were part of this problem. I always kind of struggled to fall asleep or stay asleep, right? I was kind of a grumpy kid when I was younger. I did have lots of ear infections or bronchitis or strep, or just like the bacteria building up in the body before the body was able to fight it off. So this is all coming from the same thing, no matter if you have thyroid that pops up. For me, it was psoriasis. I was diagnosed with psoriasis last year, and it wasn't like, I felt super great until it happened. Like, there was things that I always kind of knew were brewing underneath of the surface, and they all looked like digestion, sleep struggles, being crazy all the time with my ADHD, but that's another story. And so instead of seeing all these areas who seem like completely different things, we see it as one pattern. And unfortunately, the system labels each symptom separately. So we think, okay, well, this has nothing to do with right? Like, how was my nervous system? What does chiropractic care have to do with the fact that my thyroid's not working? In this case, it literally directly impacted the thyroid. It's because as a whole, we're missing the bigger picture of the nervous system and how it's lost its ability to regulate. And that is the kind of work that you get when you come in. And just like Dr. Osuna was saying, that is the work that she did with that patient to get her to the other side, where her thyroid is improving, where everything else is going to kind of head in the right direction for that patient.
And this is when you feel like you're doing everything right and it's still not working. Like, you've tried the clean diets, like you've taken out gluten, you've taken some supplements that are supposed to support whatever you're going through, functional medicine protocols, lifestyle changes, and they're going to help a little. Mm-hmm. Sometimes they help a lot, but they're just not fully. Mm-hmm. The approach needs to start with the nervous system and the foundation where there's neurological interference. So if you're not supporting the nervous system first at the foundation, it's like remodeling a house with a cracked foundation. And you can upgrade everything. You can get brand new, beautiful walls. You can take down that popcorn ceiling, paint your cabinets, but it's not going to hold up if your foundation is cracked.
Once that storm hits, you're going to have leaks.
Yep. Yeah. And that's why neurologically focused chiropractic care just hits different. It just hits different. And it's this year, I've just seen so much now in my little 3 years of practice that, like, yeah, you got to start here.
Yeah. And I think it's because I remember when you were telling your story, Dr. Selena, you're like, well, she took out gluten and she was taking thyroid. And it's like, we almost like, not that we also celebrated her for doing that because that's the work on the patient's end, right? But it's like, we've had so many patients come into our office who did that, but didn't have the chiropractic care. And they still went on years of, why is my thyroid not improving? Why do I still feel like complete garbage, right? Like, it truly does make a difference when you start in the nervous system. And the fact that she did it while getting nervous system support, her body was like, freedom, right? It's like, let's actually use this benefit, you know? So it's like, we never think that what you're doing isn't working. You might not feel like it all the time, but the reason you're not getting the results you want is because we haven't started and addressed the nervous system and the dysfunction that is hidden in there.
Dr. Veronica, do you want to share a little bit about our insight scans?
Sure. So when you come to our office, the very first thing you're going to do is, first of all, we're going to hear your story out, right? We are experts in the nervous system. We're not experts in you yet, right? So we want you to know what has been going on, the symptoms you've been feeling, what your birth looked like, even as a grown adult. You know, we still ask like, hey, does your mom have this crazy story about you that you have when you were born? After you do your history, we're going to take you back and do some insight scans on you. And that is basically just a fancy way of saying we're going to measure the stress inside of your nervous system. We have 3 different scans that we do. They're all super non-invasive. You do have to wear a gown. So that's like the most uncomfortable part, but it takes like 10 minutes and you're on your merry way. So we have the HRV, which is going to address your heart rate variability, adaptability, and exhaustion. How able are we able to encounter stress? How able are we able to get through that stress without completely collapsing? We've got our EMG, which is going to tell how much tension is in the body. Are we overactive in certain areas or underactive? And how hard does the body have to work because of that imbalance? And then you've got the sympathetic dominance, which is in that thermal, that stress mode, how much heat is showing up and how, again, overactive is the body working, but this time from an autonomic standpoint. What are your organs doing? How well are they communicating to each other or lack thereof?
So someone who comes to us with patterns of autoimmunity, we will often see in their scans really high stress patterns, poor vagal tone, and neurological exhaustion. And I just took a peek back at my friend's scans, and that is so true. That we saw crazy patterns in the tone of her system, stress on her vagus nerve, a little bit of stress showing up in what would be telling us about vagal tone, and then her heart rate variability, which tells us about her adaptability to stress, was starting to go downhill. And she was in her young 20s, and so usually young 20s, if we're starting to show some stress and exhaustion, it's a sign that it's just going to keep going that direction. When you keep that stuck pattern and you don't address it, if that makes sense. But here's the hope, and here's what we get to see over and over again every week in our office. As the nervous system heals, the scans change and the symptoms follow, right? So as we remove that stress and tension from your body, and the vagus nerve is able to talk to your immune system in the right way, right? Send good messages that you're safe and you don't have to over-respond to whatever it is, because it can be a multitude of things. Or just in general, healthy vagal tone has so many things. It could be its own book. You're going to start feeling better. You're going to start sleeping better. Your digestion is going to improve. And then those like nitty-gritty detail, long-term health indicators are going to start to come into healthy ranges, which is really exciting.
Yay. And you will feel fantastic.
Fantastic.
So if you are even just a little bit interested in, I always tell people at least come and get your scans done. You get to see a side of your health that you've never likely seen before, and another explanation as to why you've been feeling. We like to put images and understanding to all the things you've been experiencing in one concise little report of like, okay, here's what's been happening this whole time, and here's what your nervous system is saying. And a lot of people see that report and they're like, wow, it's like you've been following me all these years. It's kind of fun. So at the very least, get your nervous system checked with one of our Insight scans. You can do that by making your first appointment either at Haven Health Chiropractic in Ankeny or at Vessel Chiropractic in Boise, Idaho. Or if you're in neither of those locations, that's okay, because we also have a directory where you can find a PX doc near you who's going to do those nervous systems insight scans and show you this whole new world of your nervous system that you have been waiting to find.
Amazing.
You want to pray us out?
Yes. Dear Lord, thank you for the gift you've given us to understand the nervous system as a collective community of neurologically focused pediatric chiropractors. Thank you for allowing us the opportunity to reach our community and to bring healing hands to them so that they can thrive just as you've designed them to. In your name I pray. Amen.
Amen.
Thank you for joining us on Motherhood, Aligned and Assigned.
We hope today's episode helped you connect the dots in your family's health journey.
Remember, this is where nervous system health meets motherhood wisdom.
Until next time, we're Dr. Veronica Schiltz.
And Dr. Serena Kaufman, supporting you as you nurture your family's well-being.
Because when you're aligned, everyone thrives.